today on one of our first podcast recordings. We're going to be trying to roll out this series every week, bringing tips and tricks and helpful information to you guys about how to care for the elderly or disabled folks in your life and how we can help make their life a little bit better and hopefully giving you a laugh here and there along the way. So, all right. Today's topic that we're going to be bringing up today is actually because the day of this podcast publication will be National Fall Prevention Awareness Day, which is September 22nd. And so we thought it was kind of appropriate to make sure we touched on that topic. What do you think, Britt?
Yeah, I think that's it's a good time to talk about it and go over all the things that can help try to prevent your loved ones from falling.
All right, so we're not going to get into too many boring facts, but most folks know that falls are obviously a huge danger and risk, especially to seniors. According to the CDC, accidents are the third leading cause of death in our country. And a lot of the time, accidents are caused by falls at home. So we're going to try to talk about ways that we can prevent that from happening, because obviously we don't want to get to that point. A lot of folks, once they have a fall, it's a devastating event and they sometimes don't even get out of the hospital. It can lead to a whole cascade of things that are just things we really want to avoid at all costs. So the best thing though with fall prevention, it doesn't mean, making huge changes to, remodeling your whole living environment or changing everything. It's really just a lot of small things that you can do to really avoid or reduce that risk anyway. So you want to go over the first tip, Brittany?
Yeah, so the first tip we're going to throw at y'all is going to be avoid wearing loose clothing. So obviously, you want your loved one or yourself to be comfortable, but the pants style now that the bell bottoms are back.
They're back in style, like
so you can't see your shoes, and so we're trying to learn how to walk in them. But the bell bottoms are back, or loose pajama pants, things where it kind of hangs down below your shoes. Obviously are going to be the number one issue. A lot of people don't think about loose clothing being an issue, and it is. It's one of
that was actually one that surprised me when we were kind of doing the research. That's not a common one that I educate folks on is the clothing that they're wearing. But when I really sat and thought about it, there's so many times a lot of folks just, for whatever reason, they don't want to get out of their pajamas that day, which I can't blame them.
I would have never thought about it until, and then after we were talking about it, it was like, okay, hold on. Let me think about clients we've seen. I'm like, it makes sense. Like a lot of them were in pajama pants or sweatpants, and it's like, okay, hold on a second.
Maybe they've shrunk a little bit over the years and they don't want to accept that, and they're a little bit too long.
Yes.
So yeah, being mindful of the clothing that we're wearing is definitely.
And you can still wear those things, just hem them at the bottom, and make sure that we prevent them from dragging.
Line too.
Yes,
I remember doing that back in the day. All right. So second tip that you'll want to be mindful of is lighting it right. So, lighting, we kind of underestimate how important that can be. But having low lights or poor lighting is a huge hazard. You think about it, especially at night, having night lights for their walking path from their bed to their bathroom, or having a night light in the bathroom so that they can have some kind of visual ability to see what's going on in there. Basically, you're half asleep and you're like, what's going on in here? You want to be able to see. And a lot of elderly folks, their vision might not be perfect anymore. So one thing we want to do is go through those paths and see, what does the lighting look like? If it's not really that great, maybe putting in some brighter light bulbs, especially in those narrow hallways, stairways, if there are any. And like I said, adding in some extra night lights, maybe just a little plugins in the outlets so that they can have better, safety, especially at night, because nighttime is the highest time that we see most of the falls, because people are getting up a lot at night to go to the bathroom and can't see. And
they don't even have to be the ones that you have to turn on and off nowadays. I mean, even Dollar Tree has them where you plug them in and it can sense when it goes dark or light.
Yeah.
So they're not having to do anything themselves. does it themselves. It'll come on at night
Yeah.
and just light up the floor, the floor's way for them. And it prevents them from being able to not be able to see anything.
Yeah, and they even have the ones that are like combined with like the air fresheners and stuff
Yeah.
that have a little light on them that you plug in. We've used those before. So yeah, that's definitely super important. So number 2, check the lighting. What about number 3, Brittany? What's another tip?
So number 3 is going to be wearing shoes. I'm the world's worst about this, if y'all know me.
I can attest to that. I've seen it personally.
Especially pregnant. I'm like, but socks are very or very comfortable, but they are a huge slip risk, and people don't realize that. So obviously wearing shoes is going to be tip number 3. You've got slippers. That's a huge thing in our elderly community. What they don't realize is some of those don't have grips on the bottom of them. And it's just as bad as wearing socks. So of course they can wear house shoes. Let's just choose better options for them that have a little bit thicker grips on the bottom for them to try to help prevent
stylish
slips.
Hospital socks that everyone likes to take home from the hospital. But as amazing and wonderful as they are, it's important. That's why they have all those, white design grippies on the bottom, because it's common sense. There's a tile floor, a laminate floor, whatever, and you have a sock. Well, there's nothing really to stop you from just sliding those feet up in the air. Yep. So we have to have something with grip, whether it's slippers with a grip on the bottom, with a hard bottom, or socks, or like slipper socks that have the grips on them.
Yes.
You really don't want to wear.
And if they're huge in the socks, those are easy to find. They're on Amazon. So you can find those almost anywhere. If you've got a loved one who just absolutely is like me and hates shoes, then you can definitely get those that already have the grips on them to try to prevent that. And then Annie, what about our last tip for the day?
All right, so last, and I think kind of the most important tip, is moving more carefully. So a lot of folks, and we just kind of, I think, instinctively do this. You get up to go grab something, get up out of your chair, get up and go to the restroom, and you end up kind of going very quickly. A lot of times folks, as they get older, they have a little bit of urgency, especially with having to use the restroom. And so they're getting up quickly. And unfortunately, there's a lot of things that can happen when you're doing that. One big thing is a lot of folks have a drop in their blood pressure. A lot of people struggle with blood pressure issues, or they're on blood pressure medicines, things like that. So when you get up quickly, your blood pressure drops, you get a little dizzy, get a little lightheaded, and that can certainly cause a fall, because all of a sudden you're getting up quick and the room's spinning and down you go. So biggest thing is moving slowly, moving carefully, and moving with intention. Sometimes you have to take a second to, go from laying to sitting, sit on the side of the bed for a second, collect yourself, and then go from sitting to standing, and then go walking. It's hard to do. A lot of folks too that have dementia, have Alzheimer's, or have head injuries, have a lot of different health conditions, can have what we call impulsivity. They kind of forget to take their time, and they just go. When they get an instinct to do something, they get up and go. And that's really, really dangerous, especially in the elderly, to lead to falls, because they're getting up quick. They're not really oriented, and they're ending up on the floor. I can tell you from firsthand experience, we had a client that actually just graduated from services. So yes. Yay! Very excited for him that when we first came in, required 12-hour a day, 7-day a week care, because he was found in the bathroom in his community on the floor after a fall. And our caregiver was really struggling with him taking his time. There was a lot of situations where he was just getting up in a hurry out of his scooter or wheelchair and forgetting to put his brakes on, or not taking his time to kind of gather himself and get up. And she even had to, assist him down before to avoid a fall and an injury. But finally, with a lot of time, a lot of patience, a lot of practice, we were able to get him to that point where, we had no falls for months and months that we were in there, and his strength got better. And
he was taking all the precautions. That was the biggest thing.
And having our staff in there going over that every day with him, and keeping him safe, it allowed him to be able to graduate. So now he's on his own there, in his assisted living community, and able to kind of return to, his normal. So, that's one thing, that having caregivers in the home is a huge is a huge component too. If you have a loved one that's having frequent falls, and we don't want to end up with one of those bad outcomes, having an extra set of hands, an extra person in the home can really help reduce those risk of falls and reduce the risk of injury. So if you or a loved one or yourself are really struggling with a lot of recent falls, or you're scared of falling, some people don't get out of their chair or their bed because they're afraid to fall, because they know what's going to happen if they fall. They know they're going to the hospital. They might not get home. It's very scary. So then they just become bound to their chair and they don't ever get up, and they can struggle with that too. So yeah, don't hesitate to reach out. If you feel like that's you, if we're speaking to you, if we're speaking your language, make sure that we can come in and do a free safety assessment in the home and see if there are little tweaks and things that we can recommend to make your environment safer, or see if maybe having one of our caregivers in there on a routine basis can really be an asset that you need to keep yourself safe, or your loved one, your mom, your spouse, whoever it is that you care about in your life. But you can always go to our website at www.carecrewdfw.com. You can fill out for a free in-home assessment on the website there. You can get some more information about our programs there, or you can always call or text us at our phone number, 817-242-4717. Anytime, day or night, we always have folks there to answer your calls. So definitely don't hesitate to reach out if you feel like this is something that you're really concerned about. And that kind of wraps up our fall prevention tips for today. But tune in, because we have a whole month coming up for Alzheimer's awareness. October, we have our Alzheimer's walk, and we're going to be doing a whole month of weekly podcasts just on that topic. So if you have someone that that also might be suffering from Alzheimer's disease, don't forget to tune into those, because we're going to be giving you some great tips and tricks, especially with Brittany over there, since that is kind of her realm, my dementia Alzheimer's expert over there. So we're going to be definitely giving some great content on that. Don't forget to share this with anyone that you feel might benefit from it. We would love that. So share it, leave us some comments if there's any other topics you guys are interested in. And thank you guys so much for tuning in today. Anything else, Britt?
Thank y'all. That's it. Make sure to share us and follow us.
Yes. Don't forget that. And we will see you next time. Bye.
Bye.